All right. Good afternoon, everyone. Hello, I am Andrea Perdomo Morales, and I serve as the co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Carolyn Sasfron.
Here.
Donna Honer-Quayle. All right, we'll see if she pops on here shortly. And Sarah Behrens is going to be absent this afternoon. She let us know. Mary Gill. I don't know if we could hear you, Mary. I'm sorry. Oh, no, we can't hear you, but I saw you say present. So thank you, Mary. We'll move on, but maybe you can work with your sound there. Mike Gillette.
And I currently don't see Mike on the call.
Okay. Leanne Gingery.
Here.
Thank you. Angie Heller Workman.
Present.
Thank you. Jane Holtz-Richter.
Here.
Thank you. Catherine Reck.
Present.
Thank you. Eric Schinicker.
Present.
Can you say if I said that wrong?
It's Schinicker, but it was pretty close.
Okay, it was closer than last time. I'm gonna get there. Schinicker, is that what I should say?
Yep.
Okay. Kristen Stice.
Present.
And Robin Unruh.
Here.
Okay, and Robin, did I say that correctly?
You did.
All right. Okay, thank you. All right, I note the following BSRB staff members are also present: David Fye.
Here.
And Leslie Allen.
Here.
Thank you. Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended, so we'll be conducting this meeting pursuant to the KOMA. On April 22nd, 2022, we sent notice of the advisory committee meeting to all individuals who had requested notice of advisory committee meetings. The notice also posted on the board's website at ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials were posted on the board's website and are available for anyone to examine. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Andrea, the conference call is active. Checked before the meeting began and no individuals are there, but if I hear anyone beat to join the meeting, I'll let you know.
Thank you so much, David. The meeting is now called to order and the advisory committee will begin its discussion of the first item on its agenda. So good afternoon. Welcome, everyone. Appreciate you making time for this Social Work Advisory Committee this month, this hot days in June. So we will get started. Can we first review the agenda if there's any changes or if there's a motion to move forward with the agenda as presented?
I approve the minute or the minutes as indicated.
I second that motion.
So would that be the agenda? Sorry, and then we'll move on to the minutes.
Oh, sorry. Yes, the
No, you're
agenda.
okay.
Sorry.
No worries. Thank you, Angie. I appreciate that. And then Carolyn with a second.
Second to
All
the
those-
approval of the agenda, yes.
Yes.
Thank you, Carolyn. All those in favor, say aye.
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 Opposed, same sign. All right, motion carries. We have the agenda approved for today, June 21st. Thank you all. And next, item number 3 is the review and approval of minutes from our previous meeting, which was held on April 19th of 2022. Any changes, discussion, or a motion to approve minutes from April 19th?
I motion that we approve the minutes from April 19th.
I'll second.
Thank you. All those in favor, say aye.
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 Right, any opposed? Same sign. All right, thank you. Hearing none, move forward. The agenda, I'm sorry, the minutes from last meeting have been approved. Thank you so much. All right, next we will move on to the executive director's report. David?
Thank you, Andrea. We are still under some of the governor's direction related to the pandemic, specifically a restriction that limits our ability to have in-person meetings for most of the committees. Part of that is due to a requirement of having adequate spacing for all members that are in attendance. So we will let you know if that restriction is relaxed in the future, but for the time being, advisory committee meetings will have to continue to be virtual meetings over Zoom. In terms of staff operations here at the office, every state employee, we were asked to do a performance review for all employees. And as part of that process, we have a beginning of the year planning meeting where we go over goals for all employees. And then at the end of the year, we have a full performance review. But about halfway through, they asked us to do a mid-year check-in meeting. So in the next week or so, we'll be having meetings with our staff just to check in to review the goals that they set at the beginning of the year, some indications from us as far as their performance so far this year, and then allow the opportunity for some feedback, and then re-examining position descriptions. And so that will be something that we're working on here in the next week or two. I want to provide some updates to all of you from the board meeting on May 9th, 2022. One item is that advisory committees reported back to the board their preference for pre-approval of continuing education classes and pre-approval of continuing education providers. That is currently in the statutes and regulations for the social work profession, in part because that profession had requested that. But for the rest of the advisory committees, we don't have the authority to do those pre-approvals. But the board recently discussed that and asked advisory committees to discuss if they would like it added for their professions. They started to report back at the May meeting, and we expect additional ones will report back at the July meeting. There's been a split so far. Some have asked for the changes to be made to allow that, and some have not. So we will be making changes as the board recommends those changes. There was also some reappointments to advisory committees. 15 advisory committee members were reappointed to new terms at that May meeting. 3 advisory committee meetings were recognized as having served the maximum number of years of service, and that was Joyce Baptiste and Rebecca Culver-Turner for the Marriage and Family Therapy Advisory Committee, and Kenton Olaf for the Professional Counselor Advisory Committee. The board took care of some delegation work. They passed a motion to allow an alternate presiding officer in the rare event that both the chair or the vice chair of the board are unavailable. They also reviewed some language on regulation changes for the professions. Part of this items the board had already reviewed, but they needed to see the official language, such as some fees for board-approved supervisors, for professional counselors, and marriage and family therapists. There's also a home state fee for licensed psychologists who are practicing under SIPAC authority. There was also some additional changes to licensure for the master's level psychologist, and some changes to continuing education and supervision for the marriage and family therapist profession. The board also looked at changes to the investigation policy. We have an investigation policy which guides the work of the Complaint Review Committee, which is a subset of the board that hears investigations on complaints against practitioners. And that investigative policy is in need of some updating. So At the last board meeting, I provided a report to the board with some recommended changes and other items for board discussion, and the board should have a more detailed discussion on those points at the next meeting in July. Additionally, there was approval of subcommittees at that meeting. The two advisory committees had requested subcommittees. The Professional Counselor Advisory Committee had requested the authority to start a subcommittee on review of the Unprofessional Conduct regulations, and the Marriage and Family Therapy had requested a subcommittee be formed for work on a clinical supervision manual, which is similar to the current social work clinical supervision manual. So those all were approved. In terms of overall end of the year updates for the advisory committee relating to the Bsrb, I wanted to give a quick update on expenditures and revenue for the agency. As you might recall, towards the beginning of last fiscal year on July 1st, we were still experiencing some of the issues related to the pandemic, and revenue was fluctuating month to month with a great margin. I'm happy to report that our revenues have come in very close to what was previously estimated for this fiscal year. Our beginning balance back in July was about $2,077,000. Our current balance is about $2,035,000. So we did operate at a deficit, but that's by design. The board did approve some reductions in licensure fees back in 2019. We also had some savings related to the pandemic as far as a lack of reimbursements for travel and for attending mileage reimbursements for in-person meetings and things like that. However, we will keep an eye on fees and revenue going forward. And at a certain point, I do think the board will need to re-examine stabilizing the licensure fees, but we're not in the need to do that anytime soon in the next couple of years. In terms of other updates, I recently attended a educator meeting for the Association of Social Work Boards, ASWB. It was a great meeting, and I was able to take part in a few different meetings, one that had a number of different executive directors for their agencies, and we talked about items that we are working with and some things that we have experienced here in Kansas recently and some things that we have not. So that was really interesting to hear about that. One of the major topics that boards talked about were the terminology that was used was reducing barriers to licensure. And there was a good discussion about what is a good requirement. We are public protection agencies, and we are trusted to make sure that the individuals providing services are doing so in a responsible way and that they are appropriately trained and educated. But are there requirements in place that can be examined for the potential to remove those to allow more people to be able to provide services? So that was a really good discussion point. I provided a brief update on one of the multi-state compacts, and that is the SIPAC compact for licensed psychologists. Kansas became a member of that back in January of this year. To date, there are about 32 states that have joined that multi-state compact. Currently, there's about 50 licensed psychologists in Kansas that are participating under that compact, and that number continues to grow. I did want to make an update here about a few different items related to legislative actions. There was a meeting of the legislature on July 16th, or actually June 16th, just last week. The Legislative Coordinating Council met to approve days for interim meetings. And the last couple of years, there has been a Mental Health Modernization and Reform Committee. At least with the first set of approval for days, that was not a committee that was requested to operate again this year. However, there were a couple of committees that were approved that have a mental health connection. There is a special legislative committee meeting this fall, which will examine the need for mental health beds. It's been approved for 3 days, and it will study inpatient psychiatric hospital beds and also Sedgwick County Regional Medical Health bed expansion and issues relating to those items. There was also a special committee that's looking at some of the waivers underneath the Kansas Department for Aging and Disability Services, specifically one that's looking on intellectual and developmental disability waiver modernization. There was, under the umbrella of health, there was a special committee on medical marijuana that is going to be meeting this fall to study that topic in greater detail. And then relevant to the Bsrb, there is a special committee that is going to be meeting to look at state employee and board member compensation. And so that's going to be looking at other states, I think, in comparison for that purpose. And so with that, I'll go ahead and end my report, and I can answer any questions on those items.
Thank you, David. Any questions, concerns, comments? Quite a report, quite a busy month there, David. Thank you.
You're welcome.
All right, moving right along, we'll move into old business. And just to explain a little bit about what Carolyn and I did in this section, along with David's support, is keep the items that we decided as a committee that we would focus on for this year. And so you'll kind of notice in some of them, it's a little mixture of old business with some new items, but we just wanted to make sure to keep front and center the goals and areas that we decided all together to work on. So let us know if there's any confusion there or any feedback for the next meeting that could make it better or easier to read and follow. So under item A, we have continued discussion on unprofessional conduct regulations. And everybody should have received the copy in the previous meeting and also again attached to this meeting's attachments. And under here, wanted to continue to kind of work through the unprofessional conduct regulations, but then also a discussion on, there's a reference to supervisor in here that may be a little bit confusing. And so Carolyn and David, if you want to talk about that a little bit.
Sure. So the regulations mentioned supervisors and supervisees, and as it relates to responsibilities of certain practitioners and certain roles. And your advisory committee and some of the other ones were discussing the terminology behind the term supervisor and how broadly that should be used, whether that means a clinical supervisor, whether that means an employment supervisor, or whether it's broad and it can be used in different kind of meanings. So we did consult with legal counsel for the board concerning the definition of supervisor. And since there is a little bit of ambiguity in the terminology, legal counsel for the board discussed it with other members of their office and informed us that absent clarifying language, they believe that references to a supervisor would be within the context of providing supervision, like clinical supervision. If you wanted to have anything specific to an employment type supervisor, that would need additional language to clarify that it was an employment supervisor situation. So I wanted to clarify that and kind of bring that back to the committee. Additionally, on this topic, just to remind you, the review of the unprofessional conduct regulations was something that all of the advisory committee members are doing. These have not been reviewed and updated in a few years, but as technology has changed and there may be items that are in maybe national standards, or other jurisdictions may have items that are relevant for us to consider adding. So each of the advisory committees for all the different professions under the board are having these conversations. In the minutes from the last meeting, you can see that several of the items were highlighted for discussion at that time. And that's on the last page of the minutes, page 4, I believe. But we wanted to provide an opportunity for you today to continue the discussion on unprofessional conduct. And we provided some additional materials to you to aid in your work as you examine these unprofessional conduct regulations.
David, I'm just going to add one thing about the supervision, or those who supervise. With license, I believe at all levels, licensed BSWs, licensed MSWs, and clinical level supervisors. I mean, we all supervise at different levels, and I'm thinking that the standards that should supervisor standards should apply to all levels, whether you're a BSW, licensed BSW, whether you're a licensed MSW, or a clinical supervisor. And I think there is a definition of supervisor and supervisee responsibilities, and I forget where you say that's at, but it looks like we need something more to to apply for supervisors at any level, supervising in an agency, or my thoughts. And I'm not certain, David, where that came from, the definitions.
Yeah, so there's a definition section for the regulations for social work, and that is in 102-2-1A.
102 what?
102-2-1A.
Okay.
And I think one of the issues is that there is a definition under AA, social work supervision, and it means a formal professional relationship between the supervisor and supervisee that promotes the development of responsibility, skill, knowledge, attitudes, and ethical standards in the practice of social work. But one of the issues in that is, while that they do define that term, the definition of social work supervision includes the terms supervisor and supervisee within the definition, and the exact terms supervisor and supervisee are not actually defined in the definition regulation. So that is part of the reason why there was a little bit of confusion exactly how to define supervisor and supervisee in this context.
What page is that on that you're citing on?
Sure. So this is not in your packet of material, but in the regulations, the first regulation, 102-2-1A, has a set of definitions for terms that are included in the regulations that come after it. And so that regulation includes a large number of definitions of terms or specific words. And so when looking at the definition of supervision as it related to unprofessional conduct, it was necessary to go back and look at the definition section to see if did they define the term supervisor, to see how broadly we should define it. And unfortunately, the term supervisor is not defined in that regulation. So that's one of the problematic things in this discussion.
Well, I think Carolyn brings up a good point, because from the standpoint of going in and doing site reviews from an accreditation standpoint, and we're doing site reviews for child advocacy centers that have the therapists connected to them across the state of Kansas, and that is part of a standard that they have to have a trauma-informed therapist working for them. But that trauma-informed therapist, regardless if they're a LSCSW or not, has to be under some sort of supervision. And whether it's called supervision or peer connection or whatever you want to call it, they have to be in that capacity. We have it noted as supervision in our standard, but and that's across the board, across the United States. So I think it is worthy of being able to identify it, that it doesn't matter what licensure you're at, that we just stay consistent.
Yes, and under our license itself, anyone that's licensed, we have these standards that are common at each level. So I was just thinking that it would be nice to work on what would we need to do, David, to expand that or define that? Would that have to go through legislation next year, or do we have to come up with a clearer regulation? What do we need to do?
So if it involved just the regulation as far as the definition itself, I think that is something that could be, I think, probably taken care of in that definition section.
Okay.
So that would just be looking at another section of the regulations and then having that conversation about, is there a new definition to be added to that section, or any existing one maybe to be modified to fit that.
Okay. No, it sounds doable. Would that happen in the board, or would that?
Yeah.
Work in the advisory committees or?
So the advisory committee's authority is to make recommendations on changes and propose recommendations. And then the board would have the official authority to vote to change those things. And if it was something that would go as far as to require a statutory change, then that would require the legislature to adopt it in bill form. But if it's just the regulations, then it would be the advisory committee discussing it, putting forth a recommendation, and then that recommendation being communicated to the board and the board voting to adopt it. That's what would be needed.
So if we were all in agreement, and the next step could be taking a recommendation to the board. But first we have to be in an agreement that a change needs to take place, and then.
Now, as it relates to the unprofessional conduct regulations, as I mentioned, all the other professions are working on that and kind of dealing with similar issues that I think you guys are working with as well. One of the goals that I had for that was for the advisory committees to be able to forward those to the board at the end of the year, and then the board could review those, because there may be some changes in other committees that you would look at and want to adopt for your profession as well. So I think the time frame for those recommendations for unprofessional conduct, perhaps have those to the board by the end of the year. And then if there's items that are sort of associated with that, that might be a good time to also make those changes as well.
Thank you, David.
What does the committee think with Carolyn's suggestions and what David just said about next steps?
This is Angie. I think we should just add it to our list as we find more to join in that as we go through. I propose that we add that to be one of the changes.
This is Leanne. I second that.
Yeah, I support it. I think we're going to have some pushback on it, but I support it.
Thank you. Any other thoughts or concerns?
I think probably my biggest concern with it is, does that fall under licensing when you're talking about who you're supervising at an agency, or is that sort of fall under the human resources of that agency? And are we kind of outside what it was intended, the supervisor-supervisee relationship, as I kind of read it, is for the purposes of clinical supervision? When you talk about who can supervise what, I don't know, it feels like that's pretty well articulated. How that's done in an agency, I think that belongs to the agency to deal with, right?
Thank you, Eric, for sharing that.
Go ahead, Mary.
Can you hear me?
Yes, we can hear you.
We're good now. Yeah, I appreciate what you're saying about that, but I don't think it hurts to have parameters put down. Something that can help guide agencies as well about who can supervise.
And what happens in an agency where there's a licensed professional that is violating ethical standards, and the agency, let's say, says just fires them, but they're free to go on. I mean, I just think I think we should be involved, as a board in addition, but that's my own thought. But that could be added to the list, like Angie said, and for further discussions.
I disagreed with it too, just because it's not just clinical social work. Like, I'm at a bachelor's level, there's a master's level, there's all levels of supervision. And so that just seemed like it was speaking specifically for just one area, not all of us as a social workers. So.
Well, I guess I'm a little confused. You've thrown a little bit of a curve to me. When you speak of just agency, I was thinking as individuals holding licenses that are needing to have supervision or to have that consultation, or, to have those conversations. So private practice, to keep them from just being out there on their own. So I was looking at it from more of a global standpoint, not just from the agency, because actually the agency has more resources than anybody does to provide. They're probably more protected.
Yeah, I meant it to be global too, Jane, because it's wherever you carry that title, whether it's in private practice or you're a licensed, whenever you're a licensed social worker, whether you're BSW, MSW, wherever you're at, we're bound to uphold ethical standards in providing supervision. And believe it or not, supervisors can violate ethical standards. Not very often, I'm hoping, but it can happen.
Okay.
All right, any other discussion around that, David? Any other thoughts that we should keep in mind, or information that we need to filter through?
So we'll definitely keep track of this discussion. Just wanted to see if the advisory committee has any other thoughts on possible changes to the unprofessional conduct regulations.
Can I just bring up something that I've had a problem with probably forever, and that is when people come into relationship with each other and had each other, one provided service to another. And I wanted to ask, has that ever been considered just to be taken out, that people should never happen or discussed? Is one of the things that I read earlier, and I thought, it just seems inappropriate to me. Not after 2 years, not ever.
So there's a couple of different relationships that could be included in this conversation. And some of the other advisory committees are definitely having a conversation on that topic. And I think some of them are discussing, should it be a certain length of time, and what's the right length of time? Or are there certain ones where there shouldn't be a length of time and it should just be prohibited? And I think part of those relationships, that there's lots of different types of dual relationships, but I think probably in the context you're meaning is maybe a romantic or a sexual type relationship. And some of those groups could be the client, or it could be a supervisee, or potentially a student. So some of those have all had conversation by the different advisory committees. Looking for the specific regulation and the social work regulation that talks about the period of time for that. I guess that would be Z.
Where is the period of time? I thought it was 0.
So under 102-2-7, unprofessional conduct, if you look at item Z on page 2, the very bottom, it says unprofessional conduct to make sexual advances towards or engage in physical intimacies or sexual activities with, or exercising undue influence with any person who within the past 24 months has been one client. So you also have Y, which says it's unprofessional conduct to make sexual advances towards or engage in physical intimacies or sexual activities with one's client, supervisee, or student. So the Y is during the current relationship, or during the current client relationship, supervisee relationship, student relationship. Z has to do with after that has ended. So it looks like in the social work unprofessional conduct regulations, it's a period of 24 months. And then for non-romantic, non-sexual dual relationships, there's other types of relationships that are covered in AA, which have to do with promoting services or goods, sales of goods, financial gain, personal gratification, etc. So.
So it seems like that one would be one that we would want potentially to be universal across all areas, right?
As far as the item Z that had to do with the sexual advances towards or engaging in physical intimacies with.
Mm-hmm.
So what's interesting is just for comparison, in some of the other professions, there is a specific regulation that has to do with clients. And then some of the professions differ in terms of if the prohibition also involves the students or involves the supervisees. I think some says a 24-month period for just the clients, whereas some says you're not supposed to have that type of relationship with a student or supervisee while you are currently their teacher or supervisor. And Leslie, Allen, if you have any more to add on this, I know we've kind of jumped around because there's 7 different professions and they all have similar regulations, but there are certain differences. So my description as far as some of the differences in the language, does that kind of match your understanding too?
Yes, I believe so.
So I guess I would wonder if, because I know this is a question that comes up pretty often and there's confusion between professions on the, ours says 24 months. Others say you can never have a relationship once that they've been a client, just like you mentioned, David. So I'm just wondering if this is something that the board would, or all of the professions, if we would want the language to match across professions.
I like the idea of being consistent among professions. I don't know if everybody else agrees with that, and I'm not certain if everybody agrees to 24, I mean, those are the questions that we'd have to present to others.
I don't know why. I've always thought that you couldn't, once you accepted them as a client, it was off the table. For some reason, I missed that 24 months. Has that always been that way? Or has it been updated?
So the unprofessional conduct regulations for social work have been updated a few times. The last time yours was updated was 2008. We do have copies of the past versions, but it's been updated quite a few times back in 04, 2000, 91, 88, 87, 86. So yours actually has several updates, but I could go back and check and see if that has changed over time.
It's not a bad thing. It's just.
I understand, Jane, because for me, you just don't do that. But having said that, it's always been 2 years has been my understanding. Not that I agree or disagree, but it's been this way for a long time. And I don't know what it is in other professions, if we're similar to other professions or if other professions have longer lengths, or I don't know that.
Well, and I also wonder if maybe there's a time frame here to account for some of the rural community situation that may arise. I'm not sure. I'm just throwing out ideas. So what are people's thoughts on Z?
Well, my thought on, like Angie, we would highlight that portion and add that to the list of things to review or to revise if needed.
This is Leanne. I agree.
Okay, and then I know in a previous meeting, we had talked about technology use and updating the language around that, making sure that it's inclusive of, if it was last reviewed in 2008, we've come a long way with different technology since then.
Yes, that would be added to the list as well. And I would hope that, we could be uniform and consistent among professions, because I think these apply to all professionals, these areas.
So we have technology use, the supervision component, discussion of letter Z regarding relationships. Any other areas that we would want to update, look at?
What would we want? Y and Z? Andrea?
Mhm.
All right. Thanks.
You know, the client confidentiality, the recording, things like that. I think consistency across all licenses is important. I see the validity in having all licenses, maybe from the board looking at and seeing how much we could adopt one code of ethics as much possible. I think it's least confusing
Yes.
to many. We're doing the same work. It is, not a lot of difference when clients come through these doors, whether they see a psychologist, a social worker, or marriage and family. They don't really know the difference.
Okay, and Jane, which letter were you referencing there? I'm sorry if I missed that.
Oh, I was just talking about, the client confidentiality. Gosh, there's a lot of them really are failing to inform each client, supervisee, or student of the limits of client's confidentiality. The Q, failing to inform each client the client is entitled to the same services from a public agency, financial interest. There's a lot of generic ones on here. I'm sure the failure to disclose information presents a clear and present danger is probably on. I would hate to assume, but I would think that would be one that all of them should have on there. But electronically recording a session with that client, things like that. That's under T, but it's one. The permitting a third-party observation in a therapy session or an activity, it says, but
Okay.
Things like that, I think could be really uniformed.
I agree.
By the way, oh, go ahead.
I was going to say on Angie, did you mention something of the letters? Didn't you say, maybe I was hearing something, but we should include not only Z, but Y and Z.
Correct.
I'm not certain if you said that, Angie, or not.
Yes, I did. Yes.
Yeah,
And
and I think
alcohol and drugs.
that, well, Y is making sexual advances towards your
sorry.
engagement. That's okay. I mean, Y and Z are kind of related.
Yeah,
Wow.
we need to make sure they're both. Yeah.
Yeah, and I think that's what letters were
Great.
mentioned. Andrea.
Thank you, Angie and Carolyn. So we'll add Y and Z.
May I ask a quick question about both of those things? Why, how did it come to be that we put time limits or time frames on when that could occur? Because that isn't consistent with our code of ethics as a
Right.
profession. So conflicting. I don't know where that came from, how that was. Does anybody know how that came to be? What the reasoning was behind that?
I'm clueless, really. It's been this way for years. So that's all I know. I don't know how it started.
Because
Yeah,
I think that most people in practice most likely refer to the social work code of ethics before they look at this, and that's what they go by. So in the future, I would think that it would make sense that those aligned.
so I did a quick search, and we do have unprofessional conduct regulations going back to 1982 for social work. And in the first 18 years, the item Y was present. And so item Y does go back to 1982. Item Z, I first started seeing that appear when the regulations were modified around 2000. So it's been in place for over 20 years in the regulations, but it appears at least, and I can't really talk about why things were changed, but it seems that Y existed for quite a while, about 20 years in the regulations. And then at a certain point, it was added item Z. And I believe that was added with the 24 months back in 2000. So I don't think that time period has changed in the regulations, at least in the last 22 years.
Well, this may be a huge rabbit hole, and I don't mean to bring it up today, but I will say that being a supervisor and having been a supervisor and having to do corrective action on therapists who've stepped outside of the bounds of these, it can be difficult in your work setting, knowing that there's two different guidelines really for how to formulate the discipline for therapists, knowing that Kansas has a time frame that these code of conduct is different than like the NASW code of ethics. So just something to keep in mind.
Now, to your point on that, so we've been discouraged from just adopting another group's code of ethics or that type of language because we don't want to give that authority to the non-state entity. But at a certain point, words are just words. And so if there's language from that, that would be appropriate to be added or changed. So we modified the regulations to more closely align with those. That's definitely a discussion point the advisory committee could have.
Yeah, I think it's just the consistency that would be helpful in the language, not necessarily adopting the ethic itself, but the consistency in the language.
Yeah, Kristen, that's a good point. I'm looking at the code of ethics right now. And it's saying not engage in dual or multiple relationships with clients or former clients. So there's no time frame.
I mean, reading that, you would think, of course, I'm been a social worker a very long time, but I was taught never. So then to see it as a 2-year, you're like, oh gosh, where'd that come from?
Me too.
I was shocked.
Don't do that. Just don't do that.
Yeah, I just did. I guess that's where I was coming from, was the Kansas social work, and then to see this, and it was like they just don't align. And I think that is very interesting.
Yeah, I guess my other point would be just as we use those when doing investigations or whatever, so do agencies or employers are using those two documents too when they're trying to decide how to manage a situation.
Yeah, I think with this one in particular, Kristen, that's a good point to look at it in alignment with our code of ethics. Not that we wouldn't use the code of ethics for the other areas as well, but this one seems to make sense to align. All right. Any other areas for us to look at?
I would support keeping that on there, because if these are not due until the end of the year, we might continue to see areas to add to our list.
Yeah, I would appreciate that members could continue to review this over the course of the year. And then if there's new items, and feel free to explore other documents. As time allows, there are other unprofessional conduct regulations in other states, which could be informative in terms of what other states are doing in these areas. We don't have to adopt any of those standards, but that is something to add to the conversation as well.
All right, sounds good. So we will keep this an open item on the agenda, and you all have the copies with you. So as you continue to read, please make note of any items that you want to bring up during our next sessions that we have together. All right, thank you for your feedback and input on that. We'll move on to item B, which is the continuing discussion of education requirements in the area of diversity, equity, and inclusion. And this note is one of the feedback items that we received from the surveys that were sent out from the Bsrb board. And the feedback was that we should potentially look at including DEI training, and what that looks like, and all of that is still to be determined. But wondering if this group would like to make a recommendation to the full board that we continue to look at this as we prepare for our next legislative update items that the board will choose. But David, did I miss anything, or Carolyn, in that?
No, I don't think so.
Okay. So looking to see if we are all in agreement of moving this forward to the board for the board to look at and make recommendations. And part of this would be, if there is an ability to find some uniformity among all professions, that would be great. But at least for it to be a discussion item on the board agenda.
I so move on that. I know the last two conferences that I have attended, they have had those as conference topics. And so I think that there's plenty of opportunity out there to get ours.
Thank you, Jane.
Sorry,
David, at the last
Is that-
session,
sorry, go
I
ahead.
was just gonna ask, David, at the last session that you presented that was televised over the web, didn't the senators kind of reject the idea of DEI for psychologists, making that a requirement, and they got into a discussion over critical race theory and kind of kicked it back? Or am I imagining that?
No, that's true. So when the board recommendations were brought forward in bill form this past session, there were initially 3 recommendations by the board, and one of them had been recommended by the Licensed Psychology Advisory Committee, and then the board basically agreed for it to go forward in bill form to add 3 continuing education hours in the area of diversity, equity, and inclusion. And currently, licensed psychologists have to receive a certain number of hours of ethics and also diagnosis and treatment. And it would allow double counting of the DEI hours. So if you had ethics that also counted as DEI, you wouldn't have to get those separately. Same thing with diagnosis and treatment. At the advisory, or the Senate Public Health and Welfare Committee, where the bill was heard, they did ask a number of questions about that item, and they did take a critical approach to it, I think it's fair to say. Some individuals talked about why this topic as opposed to other topics like suicide prevention or other items. And some also did mention what you said as far as critical race theory. And some, I think, approached it from the perspective of adding requirements for licensure, and they ultimately did make a motion to remove that from the bill prior to advancing it out of committee. Now, at the time, it was that recommendation for just the Licensed Psychology Advisory Committee. And so, and I was the only proponent for our bill in that committee. So there were no other individuals speaking in support of that item. There were 3 written only testimonies, and some of those mentioned support for the item, but I was the only speaker, and I fielded a lot of questions, but the vast majority of them were on that topic.
And I would agree that if we do move this forward to the board, that I would hope that all of our professions would agree to it. So it's not just one profession, and use, kind of again, being consistent in what we were wanting, I guess. And then too, if it went that far to legislation, that there are actually people there when the bill is being, presented, because I think that, when there's a lot of supporters and versus few, I think that influences decisions as well. I could be wrong, but in my experience, the more in favor, providing testimony is going to help. But if there's nobody, if it's just David, nobody else, I mean, so, and I know it's hard to get to those hearings, when we're all working, but.
Well, and one of the things I sort of gleaned from the discussion is that a DEI credit for one person may be a culture of origin credit for another person. And how do you regulate that?
Do you have to? That's that would be also an answer. It's how do you look at it?
Well, I think the purpose of the education would be to be something different than your own culture of origin. I mean, theoretically, there's always things you can learn about your own culture, but I think the idea of the education or the CEU was to give you understanding outside of your primary or how you identify.
And another thing I was thinking of is even to tie in some of the ethics of this, so many things ties in sometimes to other things. I don't know.
I guess my side of it is that so many of the CEUs I've gone to recently are trying to work DEI into everything. And I wonder if it's not just going to become a tagline that they slap on to every CEU, like, this is a DEI included. I guess that's not necessarily a bad thing, but I just kind of wonder, how do you regulate that and make it meaningful?
Or what other areas might be included a year from now, like on suicide or any other topics that could fall under that as well.
Well, and with DEI being such a massive umbrella and how it changes literally all the time, I think it's overwhelming to me as a professional to try to keep up with. I can't imagine like a new person coming in trying to figure out what the best piece to educate themselves on. I don't know. I think it's tough.
So I can tell you that there were questions in the committee that did ask about the definition of DEI. I do recall that from those hearings. At the time, what the board had said was that the definition would be worked through the regulatory process. And so the statute provide the broad framework for the requirement, and then the regulation really fleshes out the details within the statutory authority. So last year when the bill went before the legislature, there was not a fully developed definition of DEI. And it remained to be seen how exactly that would have been defined in regulation, because it wasn't ultimately in the bill that was passed. But that is something to be weighed and to be discussed potentially as a definition of DEI that would be relevant to this topic. So.
And helpful, I believe.
because there was a little bit of confusion in the meeting from certain individuals who were on the committee as far as what it would mean, or some of the history, or the connection to it. And so I did the best that I could as far as the information that had been discussed in advisory committee meetings and in front of the board. But my knowledge on that topic area is outside of my expertise to a certain extent. And so I stuck with what the board had discussed and some of that framework, but anything outside of that would have been above what was in the bill last year. So.
Well, I think you bring a good point, David, is that is the reason for the need, is there is so much confusion, you know, and if we are some of the leaders to this profession and we have so much confusion, think about, you know, think about the professions that is working with the clients and the confusion there, and how some of them are not being able to be served because of it. And yeah, it's an interesting conversation, but it's whether it's children or teenagers or adults, we are definitely seeing change that needs to be addressed somehow, somewhere. It's not going to be an easy conversation for anyone to have, and there's always going to be some challenges, I think, with it, no matter what we do. But yeah,
I think having that definition and being clearer, you know, will be very helpful, because I'm agreeing a little bit with Eric. I have confusion over what that would look like or what that means. Not that I couldn't learn, but I think it would be very helpful just to have a better understanding, and especially if we're presenting it to through legislation. I think it's real important that we understand and we have passion about presenting.
Yeah.
Is the ask for that requirement to be something that is every renewal period, or just a one-time, like the safety training, or is it something that they're wanting to do every license renewal period?
The proposal that had been put forward last year by the Licensed Psychology Advisory Committee, and then ultimately the board, was for there to be 3 hours in DEI every 2-year renewal cycle. So I think they have 50 hours of continuing education they have to get every 2 years. So it would be 3 within that 50 requirement.
I think one of the things that stands out that from the Licensed Psychologist Committee, when we were discussing this as a board, is that you know, we all, and we have had a requirement to do ethics training every renewal period. And if you think about the history and just some comments that have been made during this committee meeting, the ethics have really not changed over the years and years and years. And so if we're requiring people to do 3 hours every renewal period on a subject matter that hasn't changed, that was one of the motivating reasons for them to request and to want to do DEI trainings, is because that is an area that is forever changing, and it's changed several you know, times in the last even just couple of years. And so to have our professions look at that and to engage in trainings and learning opportunities on a topic that is changing.
I've seen some diversity in ethics training specifying or focusing on a topic under the whole umbrella. So I wouldn't know about that, but if that's the case, yeah. I mean, every ethics training I go to is a bit different. You know, I did one on the ethics of documentation, and that was specifically for that area. And I have found other areas too. So, but it sounds like we need more. information on inclusion and diversity. And what's present is what you're seeing, Andrea. And everybody's saying.
Well, I think that's the piece that makes ethics easy to put 3 hours on, is because it really doesn't change that much. So it's easy to regulate. It's easy to slap it in and say, hey, if you do these things, it falls under ethics. And I think that's the probably difficult part of DEI is it changes, and what could be a legitimate CEU offering in 6 months may be completely falsified, whereas ethics, it's sort of a struggle to completely undo something within that short time frame.
Mhm.
What about any feedback from some that we may not have heard from yet on this item? And I think part of it is not for us to get tied today in needing to make the actual recommendation of what it will or won't look like, but just to move it forward to the board, that we would like for it to be addressed in the next sessions where we're talking about legislative items to move forward.
I would agree with it being moved forward to the board. I think we can definitely benefit from the previous attempt and the conversations that were had around that, to be more specific and to answer those questions proactively in order to be more successful in another attempt.
Mhm. I agree. And I also think that the discussions we've had today could be discussions as board we could bring forth, and agreeing with Andrea, we don't have to make any decisions. We don't have to be exactly what the psychologists would want. I mean, we can still do our own thing. So I think that the discussions would be very helpful.
I think we should discuss it and look into it more. This is Leanne.
As a committee, Leanne?
Yes,
Okay, before making the recommendation?
I think we should make the recommendation to, so it could be looked at more.
Okay, so make the recommendation, but then still keep it on our agenda items to further discuss. And then also we would bring back any updates from what the board has discussed as well from the different professions. Does that seem?
Yes, I agree with that.
Okay. All right. David, do we need to vote on this formally, or?
I think that would be a good idea. There's just been a lot of different positions that have been discussed. So I think it would be helpful to clarify that.
Okay. So if I can get a motion for what we would like to move forward to the board.
I would, this is Leanne, I motion that we take it to the board and continue to discuss it in our meetings.
I second that motion.
Thank you. All right. All those in favor with the motion?
Aye.
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 Any opposed? All right, motion carries. Thank you all for that discussion, and we will keep it on our agenda item as well. All right, moving next to item C, proactive approaches to public protection and the discussion around associate social worker license. David, I'll turn it over to you.
Okay. So we discussed at the last meeting that the Bsrb previously licensed associate level social workers, and there were still a handful that continue to renew their license. I am still looking into some of the history in terms of how things changed here and how those changes were made. But on this topic, I was curious how prevalent it was in other jurisdictions. when considering the idea of should this be reopened up, should this be something that we would start to license individual at the associate level again. So I talked with representatives from ASWB, and I asked if they had any data on this. And so you were sent an Excel sheet, which was a really interesting sheet, I thought. It had, it was kind of difficult to print, but basically it listed the different jurisdictions that have an associate license requirement. And then in that document, it listed what the requirements were, what states currently license at the associate level. So you can kind of see, and there's some differences state to state, but I thought it'd be helpful for you to kind of see what other states have out there. Additionally, I provided you with a couple of different bills from West Virginia and also one from Arkansas that were on that topic too, of looking at creative new licensing that boards around the country were examining. So this is something that I still need to do some more research on, but I wanted to provide this to you as well. So you would kind of see that. I did attend that National ASWB meeting recently, and they had a breakdown of the exams that were provided for different levels of social work. And I saw that last year, when you include all of the jurisdictions in the United States and Canada that are part of ASWB, I think there were around 400 examinations for the associate level social work license between all the different jurisdictions. So it's a small number, but it is still a group that they are providing the examination for. So, so that is there, should we want to pursue that in the future. But I thought I would just relay some data from what I have found so far, letting you know that I'm still looking at some of the history in Kansas, and let you review this data, and so we can continue this conversation while we discuss this topic.
Thank you, David.
This is another item that we can continue to have on under in the next meeting. We can continue to include this topic, I guess, as we have others.
So is this kind of like an associate's degree for a social worker, Carolyn?
This is my understanding. How about others? You know, I can't say that I know that much about, but I'm guessing maybe 2 years associate degree. How about others? What is your understanding?
That's what I see it as. I equate it to like an LPN.
Yeah.
Okay. Thank you for clarifying. I just want to make sure I was on the right mindset there.
Sure.
Do we have associates social work programs in Kansas for social work?
I don't think we do.
Leslie Allen, you might have had to step away, but if Leslie is still on the Zoom.
I don't believe we have any in Kansas now.
Okay.
Well, I love the idea of it.
Yeah, you should.
Mhm.
And our current list has not expanded, so it's the same, you know. So I'd like to see that expanded. I definitely see that there'd be a need for these services at this level, for sure.
Absolutely.
It's a little challenging to find some of the history on this because it did change a long time ago. But I will continue to keep reviewing information and try to pull some of the old testimony if I can get it, to kind of see why it was, at least as far as new licenses, why it was taken out of the statute.
That's a good way to look at it too, by finding some more information, because I never thought this was an option at any point. You know, I think it's so much information that you have to learn. So I think it was easier to make it to a 4-year degree from that. So yeah, I think the contents of what would be required under this would be important to also look at, like you said.
And David, I know you and Leslie oftentimes speak to some of the universities. Has there been any mention of possibly providing a program here in Kansas?
I have not heard it discussed by the universities. I think part of why we were discussing this a little bit was we have reports that show all the different total licensees under the BSRB. And there was this small group of associate level social workers. I think it's down to about 8 people right now. And as we have heard that, under this topic, as far as the proactive approaches to public protection, and also the next one, workforce issues, I kind of was looking at that group and wondering why we no longer license at that level, and just trying to figure out, could that be a potential solution to some of the issues that are currently being talked about?
Seems like it'd be a great program to have at a community college.
Also, too, I know that Washburn University accepts associate degrees. If they want to continue to work towards their BSW, they can, and those credits would be welcomed and, approved. So, they would have a stepping stone if they wish to continue, or they could be keep just with what they have, which is fine too. Levels of growth, I don't know, whatever you call it.
Well, and I think there's some 2+2 programs. I'm not sure exactly where off the top of my head, but wondering if that's something that we can bring back up to the
Hayes and the community colleges in Southwest Kansas, Dodge City Community College, Seward County Community College, and Garden City Community College do have that program.
Mm-hmm.
They work with the community colleges and then they transfer, hopefully for a seamless transfer into the BSW program.
Thank you, Robin. All right, any other pieces of information that we should look into? Other thoughts? Seems like overall there's some interest in keeping this on the agenda and seeing what the possibilities might be. All right. David, did we need anything else on that item?
Nope, I don't think so.
Okay. And one of the other things, if we move on to item D, discussion of workforce issues, which technically that ASW that we just talked about, the associate social worker, could fall under this workforce issues topic. We just, again, wanted to keep this on the agenda because it was one of the areas that we decided to focus on this year. Are there any business items under this topic that anyone can think of? Updates? Ideas?
Well, I think the supervision falls under that. You're talking about workforce too. I mean, could go either way.
Okay. So if there's nothing under that, like Carolyn mentioned, we can move on to item E on discussion of clinical supervision. So we have 2 items under here, and Carolyn and David, if you guys want to talk about the clinical supervision component. We've separated the 2 different items.
Yeah, so this is one of the items that the advisory committee had previously mentioned it wished to discuss. This was one of the items that was asked about in the survey that went out to social workers back in December. And there were some items that were mentioned in terms of some of the supervision that had been received and some of the individuals providing supervision. And then the board recently was looking at board-approved training for supervisors from the board-approved professions that have those supervisors, the professional counselors, and marriage and family therapists. And so there has been just a general discussion about are there adequate trainings for the supervisors that are providing services? Is there any way that we as the BSRB can assist with that? And then also re-examining the board-approved supervisor status that went before the legislature, not this past session, but the session before. It was included in the original version of that bill. And then in the legislative committee, they did make a motion to remove it, so it wasn't included in the final bill. But that is something that has been discussed previously. And so we wanted to bring it up again for the advisory committee to discuss and have comments on.
And I might add, being on the board, my first year was 2014. And this was when I joined the advisory committee at the time, this was already presented and approved. And so when the former former chair left, I went ahead and did the survey to get more information by doing the 2015 survey. So we've had two, and both of them showed some favorable, support. So this has been forever kind of a discussion. And and I think that I know that supervisors have ethical violations, and some supervisors do not know, regulations, and they're not the best and are not trained at all. Like, their training is only what they receive what they've received themselves. If it was good, then they were able to be influenced by that positive, competent supervisor and, model after that. But if they had not, they have very little training. And also too, most universities do not have classes in the social programs just on supervision, which I think would be really relevant, because at all levels we supervise, right out of school we start supervising, so this has just been on forever. And I think that there are people that are for it and there are people that are against it, but I've always been a supporter of it. What's important is what everybody wants, but we have been visiting this, and several times in the 8 years it's been passed. Yes, we moved it forward, and I don't know the exact history on that, but sort of like the CEUs and the psychologists, it's been, it was taken out when we put it in. There are two other professions that were able to present that and get that approved legislatively. So, what is that? Counselors and marriage and family. Yeah,
that's right.
So. So I don't know what people's thoughts are about that, or what direction you guys want to go.
Well, I guess I just wanted to make a statement. I don't know if it goes with what you're saying, Carolyn, but I just remember getting my license as a social worker and working in an organization that's a nonprofit and not having. I fortunately did have at first a social work supervisor to understand my job and my role in an organization, but when they left and we were not really supervised per se anymore as an authority over us to kind of keep us in balance with the code of ethics and the conflicts of an office environment, who don't take our social work standards to light when they make their decisions overall as organizations and nonprofits and for-profits and all the different places we're thrust into as a bachelor level social worker. I think we're finding that that's also been an area of concern I have seen the last 25 years. So I don't know. I just wanted to say that I think some type of supervision classes or some way to support supervisors or just support students with supervision is very key to keep a workforce that's looked as a professional practice to look upon for our needs here as a community and the state. So
I really support what you all are saying. I work as a field placement coordinator, and I think that's what I find is that it's not that people don't want to do things right, but more often they need the education and they need the support as well. And I really appreciate what you're saying, because I think if we can do that, we're going to create better situations for people to have supervisory classes, to have a community where people can turn to each other for, well, for support and for information.
You know, that's interesting too, listening to Mary and Angie. It's always been clinical supervision. I mean, I think it'd be some kind of supervisor training for all levels would be helpful.
Yes,
know.
please.
Yes. So, I mean, we could change the whole direction and say, you know, in general, we need some training.
Yes.
No matter what level.
It's refreshing training, you know, any kind of
So
checking. Yep.
Just thinking about that as too. We can change, you know, the type of training to include all, be inclusive.
And I think that's why you have me on here, Carolyn, is because I was a bachelor social worker.
Yeah, absolutely.
Okay, thanks.
Diversity and inclusion for sure, absolutely. You bring a lot.
Well, and I think there's also individuals that after they pass their exam, they really don't know who to reach out to for clinical supervision. There's no master list or of individuals that are available. So I've seen and heard of several people reaching out to try to find an eligible supervisor, and it's tough.
Yeah, it is.
But that's for all levels. Like if I would want to go back to get my master's, I'd still have to have supervision in the master's level before I could get my master's. So.
Absolutely, Angie. So when looking at this item, we're wondering if we want to make a recommendation to the board looking at training, but then also looking at approved supervision moving forward with those two items. And we can do similar to what we did with the other item, is still have a discussion here at the committee level. I do think for this one in particular, the board will more than likely ask for more information from us on our specific recommendations. Just a thought, I don't know.
Yeah, that's good. And I think that what we could bring different than what we've talked about, clinical, we can say we've even discussed, you know, broadening this to all levels, and then have a discussion about that as well.
All right, so what do we think? Any motions or more discussion about bringing this to the board to look at?
This is Leanne. I motion that we take it to the board to have it looked at, and then we discuss it further as well in our meetings.
I second that. I think we have discussed this so much that I think we need to make movement on it.
Absolutely.
All right, all those in favor with the motion to move this forward?
Aye.
Aye.
Thank you. Any opposed? All right, hearing none, the motion carries. Thank you all for your input and feedback. And I think now it's also helpful that we have those survey responses from the social workers that was sent out to really help just move forward to the next steps with those voices that we heard. So thank you all. That concludes the old business part. And I know we have about 30 minutes left, so we'll move into the new business. Item A is implementation of SB 453, the regulatory language considerations for LSCSW applicants with no clinical practicum. So David, I'll turn it over to you.
Okay. So a little background. Last year, the Bsrb put forward a bill. It was House Bill 2208, and it included a number of different items. And one of those was looking at some of the clinical levels of licensure for the different professions and re-examining all of the requirements under those professions to see if some of those should be modified. And I'll go ahead and pull up some of that from the bill. So this is part of House Bill 2208. And under the section that talked about licensing specialist clinical social workers, there was a requirement in C for those individuals to have completed a graduate level supervised clinical practicum of supervised professional experience, including psychotherapy and assessment, integrated diagnosis and treatment of mental disorders with use of the American Psychiatric Association's Diagnostic and Statistical Manual, with not less than 350 hours of direct client contact or additional postgraduate supervised experience as determined by the board. So when this went before the legislature, this text that you see that strikes the requirement of 350 hours of direct client contact was not something that the BSRB had put forward. At the time, the board had recommended that it be reduced from 350 to 200, but there was another amendment that was made in committee to essentially strike this section entirely. However, the practical effect of that amendment is that it not only struck the requirement of 350 hours of direct client contact as part of the postgraduate supervised clinical practicum, it also struck some language which allowed the board to previously evaluate other postgraduate supervised experience as determined by the board. And so with this full language struck, it had the effect of allowing us to evaluate individuals with a clinical practicum, and we no longer had to look for the specific 350 hours of direct client contact. However, after consultation with legal counsel, they said, previously you were able to review information as it related to individuals who had received a non-clinical practicum, such as an administrative practicum. But with this language struck, you're no longer able to do that because now you have to have a clinical level practicum. So that was what happened in last year's bill. And then what we took before the legislature this year had to do with, I'll pull up additional item here. So okay, so this is KAR 102-2-12. So the statute sets the framework, and then the regulation really clarifies items within the statute. So I mentioned previously the board was able to review individuals who did not have a clinical level practicum. And so I've taken the language from the regulation and sort of highlighted some of this information here. So basically, part of the requirements previously in the regulation 102-2-12 was to either have the clinical practicum that's described here in A, or postgraduate supervised experience, including psychotherapy and assessment. The experience shall integrate diagnosis and treatment of mental disorders with the use of diagnostic and statistical manual of mental disorders as specified in KAR 102-2-14. And then it previously said the experience shall consist of not less than 700 hours of supervised experience, including not less than 350 hours of direct client contact. And then it previously said this experience shall be in addition to the 4,000 hours of postgraduate supervised experience required for each of the licensed specialist clinical social worker as specified in section C. So one of the changes that was made in last year's bill was to reduce the number of hours of postgraduate supervised experience from 4,000 to 3,000. So this number here with the 4,000 was going to change anyway. However, with the allowing us to evaluate non-clinical practicums, it essentially meant that all of this in B would be struck from the regulation. So we had submitted that, and it is in the process of being struck because we currently don't have a framework right now to be able to evaluate clinical level applicants who don't have a clinical practicum. But during this past session, we asked the legislature to add back language allowing us the flexibility to evaluate the credentials of individuals who had a non-clinical practicum. And so we weren't seeking to return to the number of 350 hours of direct client contact. we just wanted the flexibility to be able to evaluate those non-clinical practicum candidates. And so they added that for us. But the next domino that has to follow is for there to be a discussion about what parameters do you want to set in regulations to allow the BSRB to evaluate those candidates. So this was the language that was in here previously. I wanted to put this before you to start the conversation on what language you think is reasonable to have in regulations to evaluate those individuals who received a non-clinical practicum. I can tell you that the individuals who went before the legislature and spoke in regards to wanting to get rid of the 350-hour requirement for direct client contact for the clinical practicum, basically we're saying that the programs that are already in existence don't need to have that requirement based on the strength of those clinical practicum or those clinical programs. But for the BSRB, we need some way to evaluate the individuals who do not have a clinical level practicum to ensure that they would be appropriate to meet certain standards as a clinical level social worker. So hopefully that helps clarify it without it being too confusing. But just as a summary, this language here in B previously existed in regulations. With last year's bill passing, it is in the process of being deleted entirely out of regulations. But with this year's bill passing, we need something to take this language's place to allow the BSRB to be able to evaluate those applicants for clinical social worker licenses who do not have a clinical level practicum. And I realize that was a lot. So Leslie Allen, if there's anything that I missed as part of that conversation, feel free to go ahead and chime in and let me know if there's anything that I didn't miss or that I missed as part of that conversation.
Oh, I think it was very good.
Okay.
So what about, is there a gap between last year and this year and graduates in between?
Could you explain that?
Like, okay, so when last year the language got taken out and this year language is getting put in, and the graduates in between that time frame, has there been any that would be affected?
Well, the thing about this specific language is it only applies to you when you apply for your clinical license. So anyone who would have graduated last year won't have applied.
Okay.
And if the language is changed before they apply, it would apply to them.
So nobody will be affected. Nobody's in that hole, that black hole.
We do have a couple of people who've been denied because there wasn't the option of if they didn't have a clinical practicum.
Okay.
Right.
But
Because
just a couple. Okay.
Yeah.
Yeah, it's a small handful of people, but we think that number will grow because basically right now, if someone applies and they don't have a clinical practicum, we can only point to the statute and say it requires you to have a clinical practicum. We don't have the flexibility to evaluate other postgraduate experience. But now with the bill passing this year, we now have that authority again to establish something like this, but it still needs to be put into the regulations again to give us some way to evaluate what those applicants have done to show that they would meet whatever would be necessary for public protection purposes, so that it would meet the same essentially or equivalent standard to those that had a clinical level practicum.
So something's got to be done pretty quickly is what you're saying.
Right, and until this is fully flushed out, we wouldn't have something to use to evaluate those candidates. So they would either be denied or their materials would be on hold unless they could go and obtain a clinical level practicum another way. That is a theoretical option, but I know it's very difficult if that's possible at all.
Okay.
So the next step is really to figure out a recommendation that could be provided to the board in terms of some way to evaluate this small group of candidates. And then the board would have to vote to approve it. And then once it's fully in regulation, then we would be able to start applying it to the new applicants.
Okay.
And I realize this is a new topic for the advisory committee. So this does not have to be something where a recommendation is made today, but for the sake of getting this starting to work through the process, if you could think about it and then have a recommendation at the next meeting, that would be helpful for us to be able to put it through to get that circulating through the regulatory process. And then that would allow us to license people after these are all set in regulation. So.
Thank you, David, for that overview. Any other information that we would need in order to revisit this during our next meeting?
No, I don't think so. I have reached out to ASWB for any programs that some programs require you to have attended a school that is accredited by CSWE, and some have alternate requirements for licensure. So under the umbrella of looking at the non-clinical practicum, I asked for a copy of that document and I just got it. So I'll be reviewing that to see if there's any other comparisons for states that review applicants with non-clinical practicums for comparison purposes. But right now I don't have anything that I can tell you as far as what other states might have in this area.
Thank you. That might be helpful. All right, so if we as a committee could keep this on our minds and be ready to discuss during next meeting, that would be wonderful. All right, the next item is B, temporary licenses for graduates of programs in candidacy for CSWE accreditation.
Yes, and I can speak to this topic. So there for the programs, social work programs in Kansas, the way the Bsrb statutes and regulations are worded is we look at an applicant when they apply for licensure and we look to see where they attended for their education. If they attended a program that is accredited by the national accrediting body, CSWE, then there's one set of standards. And then if they went to a non-accredited school, there's another set of standards. We have run into the issue recently where you have new programs that are starting up that are online only, that are essentially seeking accreditation, but they're going through a process called Candidacy, and Candidacy through CSWE can take about 3 or 3.5 years to complete. So you could have students who graduate from these programs while the school is in Candidacy for accreditation. The way that the Bsrb statutes and regulations are worded is it says, did the person graduate from a CSWE accredited program? Well, if they didn't, or if their program is in candidacy, that's not fully accredited. And so you apply the other standards. And one of the standards currently is that if you went to a non-accredited school, half of your education has to be received in residence, which is defined as physically at the school. So for those online schools that are starting up, there would be no way for them to meet that standard. So there's a number of items to be figured out for that scenario. One of those, though, is looking at possibly creating a temporary license for graduates from programs that are in candidacy for accreditation. The board briefly discussed this last meeting. I had talked with some other representatives from states, and Minnesota, which I included in your materials, Minnesota has a model of a temporary license specifically for students who graduated from programs from CSWE candidacy status. And so there's some information there. I thought it'd just be helpful for you to be part of this conversation and know what the board is discussing in this area. Some of the other professions don't have an official candidacy process. So I believe social work might be the only one that has the official candidacy process. And so, but there are certain checks that you have to reach to be in candidacy. And there are certain updates that can be provided to show that you're on path to be accredited. But what this temporary license would do is it would allow those individuals who graduate from the schools while they're in candidacy to be able to practice under this temporary license. Under the Minnesota model, it lasts for 12 months, and then it cannot be renewed. However, it can be extended by the board if the programs are still seeking candidacy or still in candidacy for accreditation. So the board can extend those licenses, and then when the program becomes fully accredited, those individuals with the temporary license would have to go ahead and apply for a permanent license, but it would allow them to be able to practice while their school is going through that accreditation process. So I provided some information to the board in the last board meeting about the Minnesota model and kind of explained the issue, but I wanted to include the advisory committee on this conversation as well, so you would know what is currently being considered for specifically some of the social work applicants in the future who graduate from some of these programs while it's in candidacy for accreditation.
Thank you, David, for that information. What are some thoughts from the committee?
Does this kind of key into the associates social work or the, you know, the, what we talked about earlier a little bit about the education requirements for what you were speaking, I guess, in the previous, I don't know, can you, I don't know, maybe I'm not thinking correctly, but.
So I think there are two different topics. On this one, I did include some materials in your packet of materials, which talk about the CSWE accreditation standards. And there's one document specifically that has about 5 dots on it, and it just shows the process by which programs go through to obtain accreditation and specifically candidacy. And so I think whereas the associate social work would be reopening that level of licensure and being able to license new individuals, this would be essentially a way for the board to license individuals who are from programs that are not fully accredited, but they're in candidacy for accreditation, and then have a way for them to get a permanent license once those individuals, their programs reached full accreditation by CSWE. The way that CSWE looks at it from their standpoint is they have a 3 to 3.5 year accreditation process. And when a school becomes fully accredited, they will look back and deem that school accredited for the entire length of time they were in candidacy. But from the licensing agency's perspective, it's challenging because for us, we have to take applicants when they apply. So if a school is 2 years into the accreditation process and somebody graduates from that school, we look at them and apply our standards and statutes and regulation. And if their school is not accredited yet, then we have to use the track that's for non-accredited schools. And one of those requirements is for the classes to be in residence physically at the school, which they would not be able to meet. So this would just be a path for us to be able to license students from schools while they're in candidacy for accreditation.
And I support that path, David, because I think with new schools popping up all over, I think it's wise to do that. And the accreditation process is very long. So this enables students that graduate from a university that's not fully accredited to go ahead and practice and continue their career.
Yeah, I guess I'm going to take just the devil's advocate on that. Mine's the other way. I don't support it so much because there are so many schools out there that are accredited, and even online schools that are accredited. And if you do your homework, you should be able to have an accredited school that you're going to, and you should know that it's accredited in that field that your choice of your career before you get involved. So it's a lot of money to be spending in a college today to go after something that's not accredited. And so I think it's a risk.
Yeah. I think I can clarify just one little distinction here, because I feel like there's at least 3 different groups of schools, because there are the schools that are accredited now, and then there are the schools that are not accredited and not seeking accreditation. And then there's kind of the ones in between where they are seeking accreditation, but the accreditation process takes so long that
Mhm.
they will have students come through before they're fully accredited. And I think based on the nature of the accreditation process, those schools that want to start fresh, they have an interest in recruiting students, because that's part of the accreditation process, is being able to have a quantifiable group of students and meet certain metrics. So I think they're pursuing the accreditation process versus the schools that are not. But given the length of time, it puts those students that are going through that in kind of a difficult process, because there's no way
Okay.
to get accredited before the school starts.
Okay, so like our university that is west of us, they went through that long process. So they had like that long process. So they had students that started in that process, right? And they would be in that group.
Mhm.
Okay, so that's what you're talking about with that group, that if they graduated before that accreditation. Okay,
Right, and they would have to be in candidacy for accreditation.
okay,
And
okay.
one of the documents is from CSWE. It has a table of contents. It's frequently asked questions. And on page 5, they define pre-candidacy and candidacy status. And so I think one of the unique things about candidacy is that there are certain checkpoints in the accreditation process they have to meet. And so it shows that they are on track to become accredited.
Okay,
It just has to do with the length of time for the students that are going to those programs versus how long it takes to get accredited. So
okay,
the schools are doing everything they can to get accredited. And then there's also, the wrinkle of, as a public protection agency, should we be licensing with a permanent license individuals who have not come from an accredited school yet? So there may be an interest in having a temporary license while we're waiting to see if that school will become fully accredited. And then if they do become fully accredited, then they would meet the normal standard for those CSW accredited schools. So it's just kind of, it's a way to kind of solve that problem.
okay. All right, then I rescind what I said.
Yeah,
Okay.
and Jane, because it really is kind of a tricky situation. You can't get accredited if you don't have students, but you're not going to have students if you're not accredited.
Right.
So it's
Okay,
kind of
okay.
vicious
All right.
circle.
I understand.
One quick statement for anyone that has gone through the accreditation process in a university. It is quite a lot of work, and CSWE is always monitoring, and there's all sorts of steps to hold the universities accountable. It's a sportive way, so it's a good process.
Okay. All right. I understand.
All right. Any other feedback on that? Okay. Anything else that you need on that, David?
Nope. I just
Okay.
kind of want to make the committee aware of that. So
Perfect. Thank you for that awareness. And then the in-residence requirement for licensure, you briefly referenced it.
yes, and so so most of the professions right now are re-examining the requirements for licensure. I went ahead and pulled up the 102-2-6. It's program approval for the social work profession. And one of the requirements in a number of the professions is an in-residence requirement. And so I mentioned as individuals, if they attended a CSW accredited school, that is sufficient to meet a lot of the requirements to move forward in the licensure track. If students did not attend a school that is CSW accredited, there are specific other requirements that are in regulation. And under 102-2-6, one of those requirements, number 10, is no less than 50% of the required program coursework shall be completed in residence at one institution. And the field education program shall be completed at the same institution. And when you look at the definition of in residence, it means physically at the school. for the purpose of completing coursework during which the student and one or more core faculty members are in face-to-face contact. As I've talked with other schools and or other states about their licensure requirements, Kansas really is the outlier in terms of having a requirement that students be physically present at schools. There are definitely checks in place when it comes to things like a requirement as far as core faculty. Certain things do have a requirement in terms of face-to-face contact, but being physically present really does seem to be, I mean, there might be a state out there that has that requirement, but as I've mentioned that in forums, it seems like no other state really have that. And I think we are the outlier in terms of requiring that physical presence for the students who went to non-accredited schools. So a lot of the professions and the advisory committees are reevaluating if this is a requirement that needs to stay in regulation as a requirement for licensure, or if that physical presence requirement is something that could be taken out without it endangering the public protection mission of the board. So wanted to highlight for you, we're almost out of time today, but if you wouldn't mind revisiting this at the next meeting for potentially having a discussion on whether this physical presence requirement as it relates to the in-residence requirement, if that is something that is still necessary for the public protection mission of the board, or whether you believe maybe that the physical presence could be something that could be removed. I would appreciate it.
And I know we are getting close to 3 o'clock. Is this something, David, that needs to be have a resolution today, or?
No, a recommendation on this or discussion will be helpful at the next meeting, but I just kind of wanted to prep the advisory committee for this discussion, letting you know that the other advisory committees are having the same discussion about potentially removing the requirement for education to be received while physically present at the school. So.
Okay, sounds good. Thank you for putting that on our radar, and we'll be able to discuss that during the next meeting time. All right, the next item is the social work compact. David, do you want to talk about that?
Sure. So there is a compact for different states. It's a multi-state compact that is currently being drafted by the Department of Defense, was the group that spearheaded this initiative, and there's been associations and a certain number of states were asked to have a representative as part of that process. It has been somewhat secret. I have not had a chance to look at any of the language yet. However, they recently came out with an announcement that the draft language should be reviewable and open for public comment, they think sometime in July of this year. So when I receive that, I will let you know, but I don't have a lot of information about it except to just make the announcement today that that is coming very soon. They've let us know that it will be available sometime maybe in the next month. And when I receive that, I can definitely forward it to you to send back any comments that, or you can make public comment yourself on that, but the announcement should come in the next month or so in terms of draft language to review.
All right, and again, just wanted to make sure that the committee was aware of what is happening, and the comments will be sought out in July. So we can also discuss that again in August when we meet. Then moving on, any committee discussion items that we need to make sure to have on the agenda for next time? Other than what we've talked about, any other new ideas or thoughts, considerations?
Well, I'm not for sure if this is where I do this at, but with Carolyn no longer going to be with us, which we'll miss greatly, how does that role get filled?
Yes, that's a great
Which is
question.
unfillable with Carolyn.
It is, you are correct. Big shoes to fill. So with that, we will move on to the next agenda item. That's a great segue, Angie. So really wanted to take an opportunity to step back and thank Carolyn for all of her years on the board and all of her time, contributions with her being in private practice. it is a big ask for her to step away from seeing patients and working on such important topics that you all have been working on. So really just a big virtual round of applause. And I see Angie has her virtual applause going on
Thank you.
for Carolyn and your time with the committee and the board as a whole. So
Well, thank you. And hopefully next advisory meeting, you can make introductions to your new board member. But that's my last recommendation. This is my last meeting. I want to just say briefly, it's really been an honor and privilege, as I think I mentioned last time, to serve as a social work board member and co-chairing the social work advisory committee. And of both of them, they've both been very educational and learning processes. But I love the social work advisory committee because we're all social workers. And that's always a neat feeling. But I just want you to know that I've learned a lot. I've worked with many, many great people, and I know some of you much longer. Thank you, Angie. And so, you know, I'm still in Topeka. So if you ever need me, not for board issues or anything, feel free to contact me. I think that information is on one of the lists that David provided. So, but thank you very much.
Well, I just want to say too, Carolyn, I've really enjoyed working with you since I've been with the board, and we're definitely going to miss you, but really appreciated all your help, and really enjoyed working with you and everything you contributed with the board and the advisory committee as well. So.
Thank you, David, and thank you, Andrea. And Leslie, I forgot to mention. I've known her for 8 years. Been here for the longest. Sorry.
You've been so much help to me, and I thank you, and I'm going to miss you.
Thank you. Vice versa. Gosh, Leslie, whoosh. Yeah, that's scary. So thank you very much. And good luck. And with,
Thank you, Carolyn.
yes, theirs will be big shoes to fill for the next individuals that come along. And Carolyn has a lot of experience and expertise that when Leslie reaches out, Carolyn's able to provide input. So we will miss you, Carolyn. Thank you again for everything that you've done.
Appreciate that. Thank you, everybody.
And with that, moving into the next item, and David will just provide a brief overview of next steps on our newest board member that will be representing the social work.
Sure. So board members are appointed by the governor's office. There's a special office of appointments that coordinates that. But the governor has full authority to appoint or potentially remove board members. Members are appointed to the board on 4-year terms, and they can serve at most 2 terms. So Carolyn is serving her 8th year now, and she'll be ending her term at the end of June. The governor's office has appointed a new board member who will take Carolyn's position. Her name is Cynthia Schendel, and I have talked to her just briefly and gotten just a brief opportunity to meet her through a Zoom meeting and talk to her a little bit over email. But I think you all really enjoy working with her. I'll save kind of a longer introduction, but she should be at the next advisory committee so she can introduce herself to all of you. But she'll be assisting the board. Officially, her term will start in July. She will be a board member at the July board meeting, which the next full one is going to be on Monday, July 11th. So.
All right, thank you so much, David, for that information, and we'll look forward to welcoming our newest committee member in August when this committee meets next. So the next item is just a reminder of our next meetings coming up. We have August 16th, Tuesday, October 18th, and Tuesday, December 20th. So those 3 dates will round out the year 2022. Hard to believe that we're almost in July. So make sure you have, I think some calendar invites have been sent out for those. That way we can have those on our calendar well in advance. And then with that, we are at adjournment. So I will take a motion to adjourn if there's nothing else.
Let me be the first to move that we adjourn today's meeting.
Thank you. Do we have a second?
I second it. I'm Leanne.
Thank you, Leanne. All those in favor say aye.
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 Any opposed? All right, hearing none, motion carries. This committee meeting is adjourned. Thank you all again for your time and commitment. Have a great day.
Have a great week.
Thank you.
Bye-bye.
Thank you.
Thank you,
Bye-bye.
everyone.